Hey guys, the other day, one of my patients really started going downhill, and I had to make multiple choices on how to proceed with their care. Do I begin to pace their heart? Maybe even give them medications to increase their blood pressure. They were exhibiting signs of cardiogenic shock, and I needed to figure out why and exactly how to fix it. In today's video, we review cardiogenic shock, why it occurs, and how we can treat it. So let's get started. Cardiogenic shock is caused due to pump failure. Remember, we think of the heart as a pump, with its sole job of moving blood around the body. By circulating the blood volume within the body to the tissues, perfusion is maintained. Recall from my overview of shock video right here that perfusion is the successful delivery of enough oxygen, glucose, and other nutrients, plus the removal of waste products from every tissue and cell within the body. If the heart is unable to move the blood around the body, perfusion would cease to happen. So how would the heart fail enough to cause hypoperfusion? In a normal, healthy human heart, the myocardium or heart muscle is able to stretch and contract because the walls are pliable. However, at times the myocardium within the ventricles or the bottom chambers of the heart become weaker, and the muscle tissue loses its pliability and becomes flabby. If your left ventricle, which is the main chamber in charge of circulating blood around the body, becomes weak or flabby, it cannot produce the needed squeeze to eject the blood to the rest of the body. We measure these amounts of blood as stroke volume. Stroke volume is the amount of blood ejected out of the left ventricle per heartbeat. A typical stroke volume is approximately 50 to 100 milliliters. If the left ventricle is flabby, more of this 50 to 100 mLs of stroke volume pools within the left ventricle and doesn't actually escape the heart, causing a decrease in stroke volume but also a decrease in preload, thus causing an overall effect of hypoperfusion. Now, what sort of conditions can cause these internal heart issues? The number one cause of cardiogenic shock is myocardial infarction, or a heart attack. When the heart infarcts, a portion of the heart muscle dies, thus becoming useless in helping to eject the blood from the heart. If the damaged area happens to be within the ventricles, muscle tissue loses its pliability and thus cannot eject effectively blood out of the heart. The second most frequent cause of cardiogenic shock is left or right-sided heart failure. Typically, heart failure is coined under the umbrella term congestive heart failure. Left-sided heart failure typically will occur first, which then leads to the right-sided heart failure, both of which can cause the ventricles to become flabby and in turn a decrease in stroke volume. Before I continue, I wanted to touch base on the treatments for cardiogenic shock caused by heart failure or myocardial infarction. In these cases, you have to support the heart's ability to pump. You should be following your local protocols and local treatments in the individual symptoms. However, what happens when you start to see bradycardia and hypotension, or even a narrowing pulse pressure, because cardiogenic shock is now setting in? In these cases, you have to take further steps and support the heart's ability to pump, possibly externally pacing the heart, or using vasopressors like norepinephrine to help increase blood pressure. EMS does not carry a magic medication to fix cardiogenic shock. The best remedy is to fix the symptoms of whatever ailment you find before it turns into cardiogenic shock. Hey, another great remedy that you guys can take a part of is to hit that like button in this video. By taking a split second to hit the thumbs up, you guys help this video spread to more EMS providers just like yourself. Other causes of cardiogenic shock are caused by a squeezing of the heart. In conditions like myocarditis or endocarditis, which is the swelling of the heart muscle themselves, or in conditions like cardiac tamponade, there is a fluid buildup in the pericardial sac around the heart. All three of these conditions cause a squeezing action upon the heart. If the heart is being crushed, then the ventricles are not able to fill with enough blood or stroke volume, and the stroke volume then decreases. This is different from the weak and flabby ventricle in that the ventricles in these conditions are normal, healthy, and strong. They just lose their ability to fill properly due to external forces. Sadly, in cases like myocarditis and endocarditis, there really are no real EMS treatments other than transport the patient to a cardiac specialty hospital. In some areas of the country, and some critical care providers are able to actually do a procedure called pericardial centesis, which is where they stick a giant needle in through your rib cage into the pericardial sac and then suck out the fluid. But don't get your hopes up, this is not a normal practice within pre-hospital EMS. In summary, cardiogenic shock is due to the failure of the pump or the heart. If your pump fails, blood is unable to be circulated to the body's tissues and cells. Well guys, that's it for today's video. If you guys want more great information on specific types of shock like septic and hypovolemic, check out this great playlist right here. And if that doesn't tickle your fancy, I'm sure the YouTube algorithm says this one right here will probably interest you. Stay safe out there, and I will see you guys in the next video.